Hello, everyone. Welcome to Focus for Sight TV. I have four things I care. I'm Dr. Agbashi, and today we'll be discussing about the difference between Chalazion and Stye. We have here.
Samuel Say Martin, a city doctor of optometry student in the University of Pharmacom of Science and Technology.
That's amazing, Dr. Boateng. It's a pleasure having you here today. Dr. Boateng, we both know that Chalazion and Stye cause inflammation to the eyelid. But doc, how do we differentiate between these two conditions?
Okay, so oftentimes people normally confuse them, or people normally consider them as one,
That's true.
but they are very different in the sense that they are both caused differently, and then the locations are also different.
Okay.
Chalazion is basically a blockage of the oily secreting gland, the meibomian glands of the eye, and then it's oftentimes not painful. And then Stye, on the other hand, look like pimple, and then they are located on the eyelid margins, and they are very painful. They are mostly caused by bacterial infections.
Wow, interesting. So Chalazion are very painless, right?
Yeah,
Okay, and Stye are very painful.
yeah.
That's interesting. But doc, which people are at risk with these conditions?
So I say everyone's at risk of getting this condition, but basically people who normally do not wash their hands before touching their eyes are
Okay.
at high risk of getting these conditions. And the ladies who don't, wash off their makeup before they sleep, will
Wow.
mostly have this conditions too. And then contact lens wearers who don't disinfect their contact lens before use will also have. And
Okay.
then, yeah.
That's interesting, ladies. So, ladies, I think you really have to work out on your makeups before going to bed just to avoid this condition.
Yeah.
So, doc, how do we prevent these conditions?
Well, I say if you do not want to get it, then you should stay hygienic as best as you can.
Wow.
So, as I said earlier, you wash your hands before touching your eyes.
Okay.
If you're a lady and then you wear makeup before you sleep, wash it off before you sleep.
Exactly, exactly. Okay, that's interesting. So, Doc, you're saying that we have to maintain a good and healthy eye hygiene. That's interesting, and I think that's the best thing to do just to avoid Chalazion and its eye. So,
Yeah.
Doc, I've been practicing these remedies, but I don't see the effect on my eye. When do I see my optometrist or ophthalmologist for medical treatment?
Okay, so first, if you have this condition right now, let's try something right now. Use warm compresses and see.
Okay.
Apply warm compresses on it. And then it should resolve within the next 24 to 48 hours.
Okay.
But if it doesn't resolve within the next 24 to 48 hours, then you should see your optometrist or ophthalmologist for further treatment and assessment.
Okay, that's interesting. Look, somebody's watching us right now and feels like squeezing or draining the Chalazion and Stye just to feel relief. You understand? Do you think is the right and best thing to do?
Honestly, I don't know who wants to do that right now, but I don't think it's the best thing to do right now because it will cause more harm than good, especially if you have a Stye.
Okay.
Don't squeeze it. Nah, don't try. Please don't try.
Just because it's a bacterial infection and very, very painful. Okay, so guys, if you're watching this, I would advise you to carry out these remedies just to avoid the conditions and then to maintain a good and healthy eye hygiene just to avoid this condition. Dr. Boateng, it's a pleasure and so nice having you here sharing these insightful and educating tips with us about how to maintain good eye hygiene to avoid these conditions. Guys, thank you all so much for joining us in this show. Guys, don't forget to like, subscribe, and hit the notification button for more exciting high tips. See you all on my next video. Bye.